person's voice, a hormone.
In this video, we will see the feedback mechanism, the negative feedback mechanism. Then I will explain, depending on it or comparing with it, the positive feedback mechanism. The negative feedback mechanism here is explained on the insulin hormone that is needed to maintain the glucose levels in the blood, because the glucose level in the blood, if the levels are more than 180, because the accepted levels are between 80 to 120 gram per milliliter. If the sugar or the glucose becomes higher, this is dangerous. This will affect the liver, the kidney, and all the functions in the body. This will be diabetes, as what we will see. So the insulin is needed when the levels of the sugar are higher in our body, after a big meal, when we eat sweets, if we eat a sandwich, anything that includes carbohydrate, finally the carbohydrate will be broken down to glucose. How the glucose will be used or will be taken by the cells when the insulin is come to these cells and bind with these cells, with these target cells, these cells will be able to take in the glucose. Okay, there is an example also that make it easier for you. The AC. The AC, we adjust the AC, let's say, at 20 degrees Celsius. Okay, it will work. We hear that it is working until the room becomes cool, and the temperature, if you bring the thermostat, and you will find the temperature of the room becomes 20. So what will happen? The AC will stop by itself. You will hear that the sound of the AC becomes very low. It means the motor, or I don't know, the machine that works, the cooler that is working inside the AC will stop. Until what? Until the room temperature becomes higher again. What will happen once it becomes higher than 20? The AC will work again to keep it at 20, to maintain having the same temperature. So when the effect of the AC is reached, it will stop. When it is needed again, it will work. Exactly like our endocrine glands. The pancreas will produce insulin when it is needed. When the insulin will do its work and it will reach the homeostasis, it will reach the needed levels of glucose, what will happen? The pancreas will stop. Let's see.
The message is amplified inside the cell. This signal goes a long way. Just a few hormones can induce great change. Once hormones have succeeded in sending their message to their target cells, and in this case, homeostasis is achieved, the gland decreases the secretion of hormones. The mechanism by which the gland stops secreting hormones is called negative feedback. What exactly is negative feedback? Negative feedback allows the system to self-regulate a response or output. The following example may help explain. A house regulates temperature.
They give another example, a furnace, something that gives heat. If it is in winter, for example, something to increase the temperature. Also, when the temperature becomes higher than needed, it will stop. Once it becomes less than needed, it will work.
Using negative feedback. When the thermostat detects a decrease in temperature, it sends a message to the furnace to produce heat. When the thermostat detects that the room temperature has returned to the correct level, it stops sending its message to the furnace. A furnace will turn on and off several times a day to keep the temperature relatively constant. Now let's look at a specific example of homeostasis using a hormone many of you may have already heard of: insulin.
What a big sandwich. Imagine the amount of glucose that will come to the blood from this sandwich. Look.
Let's say a person eats a meal. As the food is digested and glucose is absorbed into the bloodstream, blood glucose levels begin to rise. It is important for this glucose to be removed.
Here, they symbolize for us the glucose as yellow circles. Here is the pancreas. Here is the liver. This is a blood vessels that supplies, moves inside the body. Here, this part supplies the liver. The liver is one of the organs that take in the glucose. Here are target cells, as you see. Let's see how.
From the blood. Otherwise, it may cause damage to important organs such as the liver, brain, and kidneys.
The glucose becomes
Thus,
higher.
to maintain blood glucose levels, insulin is released from an endocrine gland, the pancreas. The pancreas senses increased blood glucose and releases insulin into the blood.
Here is the insulin.
Insulin travels through the blood and binds to receptors in muscles, fat tissue, and as shown here, the liver. Upon binding to receptors, insulin causes.
So the insulin will bind to the receptors in the liver, in the muscles, and in the fat tissues. These are the tissues in our body that take in the glucose. How? After binding with the insulin. So if the insulin is not released well, this will be a problem. That is the diabetes. Okay, let's see here what will happen now. Now, as normal, the insulin bind to the receptors and the liver becomes able to take in the insulin.
An increase in glucose transporters, allowing excess glucose to be taken from the blood and stored in the liver for future use. This uptake of glucose by the liver and other organs for storage restores blood glucose levels to a balanced state. Homeostasis has been achieved.
Now, the amount of sugar in the blood here is the accepted level. So he said the homeostasis has been achieved. خلاص. This is accepted level between 80 to 120 accepted. So is there any need for the insulin? No. So if the pancreas keeps releasing the insulin, what will happen? The glucose will disappear from the blood. This is a problem too. So it has to stop. It has to turn off. This is the negative feedback.
Because blood glucose levels have reached homeostasis, the pancreas will stop secreting insulin. This is just one type of hormone involved in the endocrine system. Remember, glands of the endocrine system send.
That's it. Actually, I looked for a video like this one to explain about the oxytocin, but I couldn't find someone that is like what I want. So I will depend on the explaining in our book. First of all, what is oxytocin? Oxytocin is a hormone that is needed for the delivery of the baby. It is produced in the pituitary gland by the control of hypothalamus gland. Okay? Right. When it is released in special cases. One of them, when the baby is ready to be delivered. The fetus stays in the uterus of the mother about 9 months. At the end of the 9 months, its size is enough, it's fully grown, it is ready to leave the mother's body. How that will happen? It will happen when the mother's uterus open and contractions will help to expel the baby out. How that will happen? It will happen under the effect of the oxytocin. This hormone will, when the baby is fully grown, the mother's body or the mother's gland and the baby's gland, both pituitary glands from the mother and the baby, will produce the oxytocin. This will lead to contractions in the uterus, contractions that cause pain. In Arabic, طلق. Okay. Now, if it was negative feedback mechanism like the insulin, that means when the contractions directly, the oxytocin will lead to contractions, so it will stop being released. But here, no. The contractions will lead to more release. So the contractions will lead to more release of the oxytocin. So there will be more contractions, stronger contractions, more release, more oxytocin, more contractions, more oxytocin, more contractions, until the contractions are enough to push the baby out of the uterus. Finally, when this happens, when the baby is out of the uterus, finally, it will stop. This is called positive feedback mechanism. Why positive? Because as what we had, where is it? Here. As what we said, more hormone will lead to more contractions. More contractions, more hormone. The hormone is needed, the hormone is released. When the hormone is needed, when the baby is fully grown and it has to be delivered, the hormone is released. This will lead to the hormone effect, performs the proper effect, which is the contractions. The contractions will lead to more hormone release. More hormone release, again more contractions. More contractions, more release. More contraction, more release until the delivery takes place. That's it. This is the positive feedback. I hope that this explanation is enough for this part of the lesson. Now we will talk about the diseases. Actually, the very, very important disease is the diabetes. Diabetes is very important disease. It's very famous. Actually, it is. There are two types of diabetes, which is diabetes type 1, diabetes type 2. Which we will talk about is diabetes type 1 because it is a result of dysfunction in the endocrine system, or the pancreas stops working in the diabetes type 1. If the pancreas stops working, what will happen? Now, I think from explaining the negative feedback mechanism, all of you will know. If there is no insulin, what will happen? If you eat any meal that has carbohydrate, what will happen to the sugar inside your blood? It will get higher than 180. So, what will happen to you, la samah Allah? This will affect the functions in your body very, very bad. Very bad. These are the symptoms of the diabetes. So, what will happen? How these patients will be treated? They will be treated by giving them insulin. The insulin will be given as subcutaneous injection. What do we mean by subcutaneous injections? These injections are small injections that given in the layers of the skin. They don't go to the muscle, not intramuscular. They are given only in the tissue of the skin. So they are very small, very short, and the patient can give it to himself, by himself, only in the abdomen skin, just very small shot, and that's it. There are many ways. Now they depend on small devices, small needles that are given automatically, not to feel in the pain at all, like a pen, a small pen. This pen will make a direct shot and very quick. Sometimes they depend on patches. These patches will release the insulin also continuously when it is needed, periodically, and many other ways. That's it. This is for the insulin. At the end of the lesson, they talk about some nerve damages, disorders in the nervous system. They talk about Parkinson's disease, the multiple sclerosis, and the spinal cord injury. Parkinson's disease is a very famous disease. Also, it affects a very famous boxer. If you want to find out about him, because now we have a lot of time. You can. His name is Muhammad Ali Clay. If you hear about him, he's very famous one. By the way, he entered in Islam, mashallah. He was a hero. يعني ما شاء الله, he has the first place in the world in boxing. Finally, because of the accidents that he had in his playing, he had this damage in his nervous system and he had Parkinson's. What is the Parkinson? In the Parkinson's, the cells that control the movement will be damaged. So the patient will shake his hand. How you will know about Parkinson's? The Parkinson's will can't hold anything without shaking. They will suffer to can move balanced. Mostly in the very old people, they can have the Parkinson's disease. The multiple sclerosis also, if you remember this challenge of the pocket, when they bring the ice pocket and they put it on themselves. If you remember this challenge, since 2 or 3 years it was. Why? Just to feel such as these people that have the MS, the multiple sclerosis. Also, they have Also, in the multiple sclerosis, the brain will not be able to send the signals to the rest of the body as usual. It is more complicated than this. It can't be explained in these words directly. Finally, the spinal cord injury, it may block the information to and from the brain. How? This is very clear. Injury. La samahallah, someone has an accident and the spinal cord from the middle of the backbone was damaged. La samahallah. Imagine what will happen after studying the motor and the sensory. You have to tell me if the spinal cord, la samahallah, is cut from the middle of the backbone. What will happen? That means the signals from the legs, can they reach the spinal cord? For sure no. Can the brain send any signal to the legs to move? For sure no. So this is paralysis. This means the lower part of the body will lose the sensation, will lose the ability to move. لا سمح الله, لا سمح الله. I know someone from far in my family, not close, alhamdulillah. He has an injury from his neck in a war. He was a soldier. Then all his body, he can only move his mouth. He can think very well. He can talk. He's a good writer. Someone is writing for him, but he can't move. He can't do anything in his life. Just he is on his chair or in his bed. He can't do anything. He can't move. He can't feel. He can't do anything. Just his head. Just his head. So this was because of an injury. This was from since 30 years, and he is alive up to now. He's alive in this disease. Here I will show you about the Parkinson's. The Parkinson's disease, the cells, the nerve cells in the brain that are responsible for producing the dopamine. Here.
Parkinson's disease, or PD, the neurons of a brain.
These neurons in the brain that are responsible for producing dopamine. Dopamine is a neurotransmitter. You remember the neurotransmitter that leave from a neuron to another through the synapse to do the action, to move the impulse, of the motor orders. These
structure called the substantia nigra are damaged and die over time.